Welcome to today's eLotus webinar, your leading source for acupuncture, continuing education. I'm Donna Chow, your host. This course, titled Unveiling the Digestive Chi Flow for Treatment and Detoxification, is sponsored by Evergreen Herbs and presented by Dr. David Soul. This class will run from 8 to 5 p.m. Pacific time, and we'll have 4 short breaks throughout the day, and lunch is scheduled from 12 to 1. So before we get started, let's ensure an interactive session by setting your chat preference to everyone so that all attendees can see what you're writing. If you have any questions for our instructor today, please type them directly into the Q&A box. Our instructor today is Dr. David Soul. He is a physician trained in both TCM and conventional Western medicine. With decades of experience treating over 100 patients daily as a single provider, his clinic has helped numerous individuals restore their optimal health through effective treatments and efficient clinical protocols. To discover more of Dr. Soul's courses, visit his instructor page at elotus.org. Let's go ahead and now welcome Dr. Soul and dive into the session.
Can everybody hear me?
Yes.
Okay. And the moderators, we'll do a quick check on our end, make sure everything's good. Everything is good. We have a few audience, live audience here as well. Okay. Welcome everybody. First of all, I want to thank Evergreen for everything that, okay, camera's over there. For everything that you have done for the Chinese medical community or Asian medical community. I don't like to call it Asian or Chinese or Oriental. Healthcare is healthcare, period. And so how can we integrate? That's the most important. It's taking what's modern, our understanding, versus something that it may not be modern, that's traditional. And that's a term we like to use, the traditional medicine versus conventional medicine. And then we'll talk about like into the detail of it. So we'll go through the process. So I want to thank Sam, the technical aspects for helping out, Tina, and of course, Zhang Chen, the Chen family, how amazing they're doing to provide this opportunity for all of us to progress in our medicine, in healthcare, period. And also Donna and all the people who are helping, Rena, thank you very much. Okay, let's get started. Healer. In Chinese, a character, 医师, meaning the healer. And that's what it is. That's all it is. It's not a title doctor. It's not whatever status that might be associated with that title. And I don't want any of that status. I am a healer. And that's all I am. And nothing else. But how can you be the best healer that you can be? Someone who heals, not just managing symptoms. Yes, we'll talk about what that means. But actually heal the body and restore the function. And I'm very passionate about that. Yes, I am very passionate. And I hope you are too. Oops, I'm gonna go to play. Okay, there you go. So let's define what life is. And for those of you who joined us the last time, there might be some repeat. And I don't know how many of you are new, how many of you are not. But one thing that the ones who have been here once, there'll be some repeat, which is good. So life, I define as love in full emotion. And that is my passion. And love is therefore the key ingredient to health. Without love, there's no healing. You gotta have that love. We'll talk about what that love means. And today, the presentation, the outline presentation, we'll get into the flow. And not just for today, but the flow of what chi is, what energy is. Yes, we all study it. We kind of know what it is. But until you experience and live it, you really know what it is. So conceptually is one thing, but truly understanding it and living it is something else. It's entirely different. So the first half of the day, we'll focus on more the diagnostic aspect, on the understanding aspect and diagnostic aspect of it. Later in the afternoon, we'll talk about the treatment and some possible things that we're gonna do. And of course, we'll do some palpation. And then you have to understand the function. If you want to treat this function, you have to first understand what function is. If you don't know what function is, how are you going to identify it when person is getting better? And so this is very important, very, very important. And so we'll go through that process. And if we have extra time, last time we didn't, we ran out of time. There's so much stuff that I would love to share. And so we'll focus on that. Later, we'll get into autophagocytosis, the detox, the natural detox in the body. And I'll give you some of the cases, amazing cases that we have done going through that process of autophagocytosis. Yes, someone, a Japanese doctor, won a Nobel Prize on this back in 2016. And many people use it different ways to market it. Yes, sometimes it works, sometimes it may not work very well. You have to understand the totality of it. And so we'll get into that as well, the detox aspect of it. And we'll get into all of that. Anytime you have questions, please type it in, and our moderator here, they will collect the questions and they'll give it to me and I'll answer it accordingly. So along the way, I'll ask if you have any questions. But anytime, if you feel like typing question, please do. Please do. So we're gonna talk about food. See, who doesn't like food? I think we all do, right? Okay, but before we get into that, let's talk about learning and understand the different levels of learning. So the 3 levels of learning, the lowest level is imitation, meaning that whatever people is giving you, you just repeat it and replicate it. It's like flipping the burger at McDonald's, right? With the timer, ding, and you flip it. Ding, you flip it. At best, if your learning is that level, you can just replicate what everyone else is doing. That's the lowest level learning, imitation. Let's take it higher. A little higher level is integration. And integration is take what you learn theoretically in the classroom, in the books, and then apply it to the clinical world and look at it from different perspectives. Do I know everything? Of course not. There are a lot of things I don't know. I'm here just like you. I'm learning with you. We're learning together. But for me, it's be able to take the things that I knew at one time, and sometimes I'm not sure if I knew it or not at one time. And take that and start integrating, start applying. And once you're able to apply and see things work differently, then you can start innovate. And so that innovation level, that's what we want to go to, all the way to innovation. But before we go to that innovation, you have to go through that integration. And so I'm here to help you how to integrate. To understand this function, you have to know what function is. And so if you don't even know the function, how can you know when that this function is getting better? And the theoretical learning versus practical learning, that's exactly what it is. Theoretical is the classroom learning. And earlier I was talking about in medical school, a lot of school, they just put you in the classroom for 2 years. You sit there, you learn all the theoretical stuff. You don't know why you memorize all the stuff until you get a clinical, and then you already forgotten half of it. And so the newer approach to the learning is case-based study. And so that's more of a practical learning, practical training. So you always challenge your learning. Never ever take it for the face value. Challenge it, use it, make sure it works. It may work, it may not. If it doesn't work, ask why. Why doesn't it work? And if you don't know the steps along the way, how do you know? How can you examine what works and what doesn't work? So you have to know the function step by step. So the progression of pathogenesis. So how the pathology progresses, that's very important. Yes, we all know it starts with inflammation, and we'll get into that. So scientific method, how scientific is scientific? I had that discussion with my dad. He has passed last year. He's in a better place. And he is a scientist, he's a medical doctor. And a lot of times I would tell him about Chinese medicine. He would say, it's not scientific. So I challenge him, how scientific is scientific? The things that we consider scientific 10 years ago is no longer scientific. For example, at one time, we hold on very tightly to sodium as the cause of hypertension. So through the 90s, salt was the enemy. And now we know there's only about 30% of the population is sodium sensitive hypertension. And so is it actually scientific? And we're not negating scientific, we need a scientific method to challenge what we know so we can go beyond what we don't know. And so Chinese medicine is very different, or Asian medicine, or traditional medicine, not just in Asia, in India, in different parts of the world, is through observation. And what I love about observation is it does not change. Sun will come up a certain time of the day, a certain season. That's observation. That does not change. And yes, Happy New Year, everybody. We just said that. Lunar New Year. Yes, Lunar New Year is much more accurate, and don't just give it to Chinese. A lot of traditional cultures, we use Lunar New Year. The first is always new moon, 15 is always full moon. And so it's exactly the same every year. And the calendar we use, I don't know how scientific it is, but every 4 years we have to compensate for 1 day. And so that Lunar New Year, energetically, is much more accurate. And then we'll talk about that. Okay, scientific method versus observational patterns. And so with patients, it's very important, you have to observe the patterns. If you don't know the patterns and what we represent, what you're doing is, do not, and I repeat, please do not assign a condition to someone, to label someone. That's why I don't call it condition, I call it transition. A lot of times, and you see this in patients, they hold on to a diagnosis and they start looking for the symptoms. And then later we'll talk about the law of attraction. If you look hard enough, you'll find it. It's the elephant in the room. So it's not a condition. Think of it as a transition. And in Chinese medicine, when I say Chinese medicine, it's encompassing all the Asian medicine. The Chinese medicine itself, or Asian medicine, is focused on pattern differentiation. So you never label, which is good. And that's what you want. And the pattern changes. How can you change the pattern? That's most important. And for me, I have the honor to have that training in both the East and West. And so I'm going to bridge the two. It's very important to bridge the two. It's one human body. It's not Eastern medicine, Western medicine. No, it's one human body. To me, it's whatever works, right? And so is there a place for medication? Of course, there's a place for medication. In the ER, we use medication to save many lives. And so, yes, we definitely need that medication. To what degree? At what point medication is working against us, not for us? So you have to differentiate that. And also, bridging the East and West, interestingly, we're in the energetic medicine, or healthcare, if you will. So that energetic healthcare is focused on energy. The Western medicine, as it's practiced now, is based on chemical. So it's a chemical healthcare. Most of it is based on the chemistry. Medication, drugs, they're all chemistries. Is there a place for chemistry? Yes. Is there a flaw in that chemistry? Yeah. Also, yes. That's why the textbook gets updated every year. And we may addendum along the way. And so you have to keep up with the latest. I rather know the observational and then use the understanding. And for me, is having that training first in the conventional medicine, and then use that to understand the observation and be able to bridge the two. And I would like to share that with you as well. And I'm sure many of you also have that experience. And so we'll learn from one another. So the clinical learning and the training opportunity I talked to Tina after last session. One thing that I feel like is missing in our medicine, our healthcare approach, is we don't have enough clinical training beyond the school. And whatever we have in school, is that enough in the United States? I feel like it may not. Because if you look at medical doctors, for example, they have at least 3 years of clinical residencies. So you're actually following a case from beginning to end. We don't have the opportunity. Even with the clinical hours that you have in school, it's limited. And once you graduate, you're on your own. You never really have the opportunity to truly treat a case from beginning to end. And so for any one of you who is maybe interested in gaining more training or the continuity of that training, feel free to contact us. We'll have that information at the end. And lastly, effective efficiency. You may not think it's possible to treat that many patients in a day. It wasn't my choice. It was just, we had a lot of patients. And when we had all that patients, I don't want to push them away. So we have to find ways to create that effective efficiency. And that's why we're able to do that. We do see a lot of patients. And yes, how many needles do you need? That's the answer I gave last time. How many switches does it take to turn off the light and turn on the light? Only one, the right one. You can bang on the wall 10,000 times, now turn on the light. And that's what the acupuncture is. You have to be precise, accuracy. You have to be precise on the point. If you're off, you're off. And even if you're on it, is energy coming to you or is running away from you? That's another consideration. And so you want energy to come to that needle. And so later we'll talk about the law of attraction as well. That law of attraction will allow the needle to come to you, or you're going to repel that energy. And we'll talk about that as well. So that effective efficiency, people want to know how I run the clinic, and believe it or not, we see a lot of patients. Our 7-hour day, sometimes 6 hours, we work 20 hours a week. Not a lot, but we do see a lot of patients. And it's over 100 every day. How do we do that? And how can you do it efficiently? If people are not healing, they won't be coming back, trust me. They won't be coming back. And they're coming back for a reason, and they're referring other people for a reason, because it's very effective. And all of you have that potential to provide that effectiveness to the care. Okay, let's talk about flow. The entire Asian medicine is hinged on one word. And I dare to say in healthcare, period, is hinged on one word, flow. If there's no flow, therefore pain. And that's what it says, 不通则痛. If there's no flow, therefore pain. And let's break down the word. For those of you who do not know Chinese, I'll talk about it briefly. When I talked to Machiosha when he was around, and he wrote a lot of your textbooks, he doesn't speak Chinese. I tried to speak to him in Chinese. He said, he used the characters. And so I encourage you to understand the character that we use and what it means. Chinese character is very profound. It contains a lot of meaning in it. And so, 不通则痛, and yes, this is the traditional Chinese character, not a simplify. Traditional encompasses more meaning than the simplify. So yong is inside of this. It means path. It means path. Without a path, there's no flow. And so for the flow, you have to establish the path. What path are you taking? Which path? Is there flow? Is there counter flow? Absolutely. It has to flow a certain direction. And that's where electro comes in. How do you hook up electro? Where does the positive go? Where does the negative go? And one thing is, at any given time, is there any topic that you're interested in learning? go and type it in so I have a better idea for the future. So if you want to learn more about the electricity, how they flow, and how you should hook up the electricity to promote the flow instead of counter the flow, you can go the opposite direction. And also the frequency, and we can get into that. We'll save that for another time, but that path is extremely important. You have to determine the path of the flow. And then within the yang, underneath that is yong, meaning useful or functional. So whatever you do, you want to make sure it's functional, it's useful. Because it's not functional, it's not useful, you just throw needles into the body, hoping that it'll work. And I hope you can do more than that. If you're following just a protocol, I'm gonna ask you why you put in those needles. If you cannot explain why you are using a specific point, then you really don't know. So you have to know the path and how to use that path to provide the flow. So that's that character, which you'll see here in tong, meaning pain, and tong also. And so this radical on the side here, chuo, which we don't use a lot, but it means to walk or movement. And that's what flow is. You have to once determine the path and make it functional, you have to make sure it moves. No movement, I think that person is dead. And I'm talking about at all levels, and we'll talk about different levels of the flow. And then this radical here, no, it means disease. So if you have a disease of the path, disease of the function, that's what it means. So you see how profound Chinese characters are. And that's why when I was doing, when I was interpreting, I did that one time at church. And if you look at the Bible, the Chinese, very short, the English, very long. Because Chinese encompasses so much more meaning. So I encourage you, because you're learning this medicine, to learn the characters, to learn the radicals and what it means. And that's what the wisdom from our late Machiocha. Okay, any questions so far? No, it will go into the qi, the word qi. What is qi? It's so elusive. For Chinese, we use the word qi all the time. And elusively, we can call it energy. Yes. Some people call it life force. It is life force. Is it movement? Yes, it is movement. Without qi, there's no movement, right? No energy. So what is qi? Simply put, it's a flow of energy. But what kind of energy? Can you see energy? We may not see the energy. We can. The light is energy. Movement is energy. But how can we more precisely define that energy? And that's interesting because if you don't understand the energetic and the positive and negative energy and how it flows, and energy, what it means, is energy a wave? Is it particle? Is it electrical? Is it magnetic? Or is it both? And yes, Einstein defined it as both. And we'll talk about what that means. And we'll get into the thinking and feeling. Is a component in that's related to energy. And I'm going to do a little preview of our next webinar. We'll be focusing on the emotional, sleep, and also breathing. And yes, breath, that's also the energy. And for those Hawaiians, you'll know ha is energy. It's that breath of life. Without the breath, there's no life. And so last breath a person has, it's the end of life. And so that breathing, that breath is extremely important. Now let's talk about law of attraction, and then we'll talk a little bit about the thinking and feeling. Because you as a provider, you have to make sure you're thinking properly. You as a provider, you have to make sure you're feeling properly. Because if your energy is off, your treatment is off. Count on it. At least that's my only experience. Challenge it, make it your experience. That's why love is a foundation of healing. Love is the flow. Love is the only energy in the world. everything that you see in the physical world because someone loved something that was created. If there's no love, nothing is created. And understand, love only flows from heart to heart. Only flows from heart to heart. For me, we don't schedule patients. We don't schedule names. What we do is we schedule hearts. So when you're treating that person, it's not a body. It's the heart that you're treating. And that heart, make sure it's coming from your heart. That's the only way that love will flow. It's from heart to heart. It's from heart to heart. And so go beyond that. And our staff, we tell them right now, we only have 2 staff ever since pandemic. And yes, we're seeing a lot of patients with 2 staff. Effective efficiency. And if you want to know that topic, we can cover that topic too. I want you guys to be successful as well. And so that heart to heart, and I tell the staff, every person that walks in the room, treat that person like your own brother, your own sister, your own mother, or your own father, and nothing less. Show them the love. Show them the love. Okay, let's talk about law of attraction. We all play with magnet before, right? And you know, magnet, you have a positive side and a negative side. And we cut it in half. Are you going to get all the positive on one side and all the negative on one side? No, you still get 50-50. Doesn't matter how small you cut that magnet. You can keep dividing it. It's always 50-50. So understand the energy. There's always that 50-50. Now the reverse is also true. What does that mean? Let's say you have a magnet and you're holding on to the positive side. And we know this side is negative. What are you going to attract? What's going to come towards you more? More positives. And the end result of that is you're going to have more positive on this side and negative on that side. So the negative will be further away from you. But also one component. What's repel? The negative. That's the law of attraction. What you're holding on to is what you attract. So a question I have for you is, what are you holding on to? Are you holding on to love? Or are you holding on to fear? Without love, there's no healing. Make sure you're holding to that love. That law of attraction. Very, very important. When I was teaching, and some intern and some are actually graduates, and I put a probe to the point where I want to put a needle. And the person will put a needle and nothing, no energy, no energy. And I know that's the point. So what I did was I put my hand on it without even removing the needle or changing any position of the needle, there's energy. And when that happened over and over and over again, I began to wonder why. And interesting, it's the same individual. And they're good students. They make good grades. It's not that they don't know the points. It's not that they don't know the material. But it's the energy. It's the energy. When you're holding on to the wrong energy, you're going to repel the positive energy for the healing. So make sure when you put in a needle, you put in a needle for the heart in front of you, not for the body. And so that's very, very important, that law of attraction. Today, that's not our focus, but I do want to touch on that for one reason, because later it's going to be very important when you're palpating and you're doing the Zhiya to correct, because at that point, you are the conduit. And if your energy is off, you cannot be a conduit. That conduit is not successful because if the patient is blocked and you are the conduit, you're using your both hands as the conduit, using one side to do the acupressure or to do the points, and the other side to relieve the tightness or any dysfunction, you become the conduit at that point. And if you're not at the point that your flow is in a positive flow, you cannot be a conduit. And so that's very, very important. Don't treat diseases. There's no point. When there's darkness, just bring the light, bring the love. And so it's very important that you're able to bring that love, bring that light. Okay, so we can get into more about the electrical flow and the magnetic in the future. I'll talk about it a little more. So we know the smallest particle, stable particle that we know is an atom. And in that atom in the middle, you have proton, you have neutron, and then you also have croutons. No, you don't have croutons. It's the stability between the proton, the positive, and the electron around it that allows it to be stable. Imagine when it's out of balance, the catastrophe that can cause seeking its way back to the balance, to the harmony. That's the electrical flow, the electrical harmony. And how about magnetic? What about magnetic? The largest ecosystem we live in is called the Earth. And on Earth, we know there is North Pole and South Pole. And I know for a fact, North Pole, that's where Santa lives. It's the difference in the magnetic field between North and South that allows the Earth to spin. If this field is no longer exists or is not there, we won't be here right now. That's a magnetic. So the electrical energy and magnetic energy creates an electromagnetic field, and I call it your energetic signature. So every object has an energetic signature. Every object has energetic signature. That chair, this desk, everything in this room, a person has an energetic signature. And in the future, when we get into emotion, I'll talk about what that means. Okay, any questions? No questions so far. Okay, I think it's early. We're still waking up. So energetic signature. So 3 direction of flow. Anytime you're thinking and feeling, make sure that direction is outward from your heart to another heart. And make sure that you truly care for the person. You want that person to be better. So there's upward in value. So outward and upward. And make sure it's forward in time, not in the past. Some people get trapped in the past, especially when it comes to mental, emotional. People get trapped in the past. And in the future, we can also talk about that aspect. And as a man thinketh in his heart, so is he. So you're thinking and feeling the synchronicity of both. Thinking without a feeling, I call it daydreaming. So you want to make sure there's feeling towards it. Okay. Flow and health. Let's touch on that a little bit. So functional flow. So there are 3 levels of function. And the lowest level, of course, is the physical. So you have the physical level, physiological, and then psychological. So if you look at the 3 levels in psychological, yes, encompassing both emotional and spiritual. Physical is the lowest level. Anything that happens at physical level, does it affect here? And how about here, downward? So if you just have a thought of fear and terror, what happened to your heart at the physiological level? Start to speed up. What happened to blood pressure? What happened to your digestive tract? What happens? Many things happen instantaneously. Just having that thought of fear. So what happens here will affect everything below it instantaneously. If you have a cut on the skin, it's not going to affect you physiologically, psychologically. Yes, there's some physiological aspects that turn on, do the repair, but it won't necessarily go all the way up here. So this is one of the key components in the healing. And we'll talk about that emotional aspect. Does emotion affect digestion? Well, you tell me. It does, and we'll get into that as well. Emotion will shut down the parasympathetic system, and will kick in the sympathetic system. And we'll talk about what that means in a bit. And so understand that three component of that flow, the physical flow, this is the lowest level. And physiological flow, yes, all the chemical reaction, the things that we may not see instantly. And then psychological, that we don't see, but it's there. It's there, and this affects everything else below it. And constitution versus pathogen. And this is very important. Are we focusing on pathogen or symptoms? Or are we focusing on the function, the constitution? And so pathogen, what is pathogen? Pathogen is anything that can generate disease, disharmony, disorder, the things that we don't like. It's your pathogen. On the other side is your constitution. And we call it 正气 in Chinese. 正气, the constitution. And constitution is more than your immune system. It's every single function in your body, including your immune, cardiovascular, digestive, every single system in your body, and how well they work together. Remember, you're one body. So that constitution. And really, it's a battle between the two. If you have 400 soldiers here, and you have 200 here, and they go into battle, of course, pathogen is going to take over. It's going to win. But by the same token, if you have 400 here and 400 here, exact same number, but then you have 2,000 here. This doesn't stand a chance. Can you get rid of pathogen around us? Not really. The flu keeps coming back every year. But why do some people get it and some people don't? Because of constitution. So the key is, how can we improve the constitution? And what are the factors to improve the constitution? And what are the factors that we measure the constitution? And so that's very important. Typical Western medicine focus on pathogen. Is managing the symptoms. If there's a crack on the wall, you want to just patch that crack, or you want to fix the foundation. Yes, it takes more time to fix a foundation, but you do want to fix a foundation. And so that's a key component, is between the pathogen and constitution. And inflammatory response shows as a dysfunction. The initial stage of disease is usually inflammation. It's usually inflammation. Can you see better? Okay, we're doing some correction. So inflammation and the signs of inflammation. The four major signs of inflammation. Pain, yes, but we're gonna differentiate what kind of pain, so you know it's acute or chronic. And what's another sign? Heat. And you may not feel the heat if it's deep. It may not come to the surface. Sometimes you can feel it, and of course, redness. You may see it if it's on the surface. If it's deep, again, you may not see it. And then also edema. You need all four of them to be present. No, all you need is one. All you need is one. Okay, and so acute versus chronic. Let's differentiate that a little bit. This is very important, especially when it comes to acupuncture. When there's acute inflammation, the type of pain in Chinese medicine, we call the axis signs. Don't touch me. It's painful, it's swollen, don't touch me. That's your acute inflammation. Chronic is more of nagging. Oh, it feels better if you rub it, massage it. It feels better, but it doesn't go away. It's always there. And so that acute versus chronic is extremely important when it comes to acupuncture. That's how I determine when I do local or when I do not do local. If there's a lot of signs of acute inflammation, please, please, please do not do the local points. You can make it worse. One time a patient came in, and I've been treating her for other stuff, and that day she happened to walk the dog, and the dog was a strong dog, pulled her, and then she fell and bruised her ribs. And it's hard to breathe. So yes, I checked to see if the ribs are out of place and make sure there's no fracture, and we did a few physical exams. I decided that day, let's do some the TCM, just put the needles in the area. Ooh, big mistake, big mistake. Did she feel better? Not really. She's in a lot of pain. I came back 20 minutes, let's take the needle, let's do something else. So I used at this point, distal points, and we're able to relieve the pain instantly. And challenge yourself, especially when it's acute pain without structural, the key word is the structural issues. You should be able to stop the pain instantly. Even without needles, you should use your fingers. If you can get to that point, then you know where the switch is. And so before you insert a needle, what I want you to do is use a distal point, see if you can relieve the pain. And you should be able to relieve the pain. If you cannot, you may be in the wrong place, or your energy may be off. So those are, or there's a structural issues. When there's a major structural issues, sometimes we cannot use acupuncture to override it. And so that's very important. Challenge yourself in your skill and making sure that you're there to care for the patient. And we talk about symptoms versus the root and function versus disease. So 3 key to optimal health, period. Only 3. First, you have to give the body what it needs, whether it's water, oxygen, or nutrition. And if you don't give it to the body, can you expect the body to heal? And that's one thing that sometimes I tell patients too, is if you just do acupuncture and your body's missing something, your body will plateau. You may get better, but you get to a point that your body will plateau. And are you missing something? Whether it's something that we can use using supplements, or some food that you're not eating, or not enough water, or not enough oxygen. And herbs also. Sometimes some people need the herb. I don't always take herbs. My wife does. But during the pandemic, we did. I was very religious. And knock on wood, we did very, very well. And if you want to know more about that, we can also talk about that. I know a lot of people already talking about using herbs for the COVID. We did very well for us and also for our patients. And I can talk about that if you're interested in that. Okay, one thing that I want to, going the wrong way. Okay, I'm way. Okay, oxygen. Our next webinar in March, we're going to touch on breathing more. But I like to touch on it a little bit because it is important for today also. And that is oxygen and how we're breathing. Nowadays, most of us, because of our habit, we sit a lot more and we don't move much. So we're compressing the abdominal cavity as well as the chest cavity. And we're doing more of chest breathing instead of abdominal breathing. If you look at baby, how do they breathe? Abdomen. And over time, as we get older, we start breathing from the chest, which is necessary because we are born with a larger abdominal cavity. Over time, we start developing our chest cavity, but we do use the muscle, different muscle. Yes, you have the diaphragm and you have different accessory muscle for the breathing. And what muscles do we use for that breathing? And you heard the term, if you don't use it, you lose it. So that abdominal breathing is what helping us to increase our TLC, the total lung capacity. And I'll talk about it briefly with a specific type of breathing exercise. And this is something that you can do every night before you go to bed. Doesn't take that much time. But this will help you with the flow as well as your oxygen intake and definitely your total lung capacity. And it's Wim Hof. You can Google it. He has a website. He's Swedish, I think. He has a website. He also has videos. I'll start with the beginner one, but I'll talk about some of the basic principle underneath to support that. It has to do with the pressure, the difference in the pressure. So this particular breathing is focusing on holding your breath upon exhalation, not inhalation. And the difference is, so you have the pressure, and you have lung on both sides in the pleural cavity. So you have the pressure here, you have the pressure here, and the pressure, the atmosphere pressure, and the pressure of the lung. And unless you have a puncture, we're not gonna worry about this pressure. So which breathing is harder? Is it exhalation or inhalation? See, it's a trick question, isn't it? Some people say inhalation, some people say exhalation. In a normal state, when we push the air out, we create a negative pressure between here and here. And the tendency of higher pressure outside, lower pressure here, there's a tendency for air wants to come in. So actually breathing in is easier than breathing out. You're inhaling against the pressure in a normal state. And so what happens with the Wim Hof, he's having you hold your breath upon exhalation. And yes, you can do it. Doesn't take much to do. I've been doing this since pandemic. And what's interesting, when I started doing it, I was able to hit 100% saturation on a regular basis because of breathing exercise. And the reason I did that exercise is because we had to wear a mask, not getting enough oxygen. And so we want to make sure you get enough oxygen. And so what he has you to do is he has you breathe in and breathe out, breathe in, breathe out, and get to a point you'll have you hold your breath on exhalation. And on that exhalation, you're creating extreme negative pressure, negative pressure, negative pressure, negative pressure. You're using your muscle to hold that negative pressure. And to the point when you start breathing in, all the air comes in and it expands the lung. It expands the lung. And that's how you increase the lung capacity. And you can literally have more oxygen in your air, not only in your airway, but you're able to exhale out all the carbon dioxide and inhale all the oxygen. And later we'll get into the pH, how that balances the pH in the body. Yes, it's a respiratory alteration, whether it's acidosis or alkalosis. We use carbon dioxide to initially control the pH of the blood. It's a huge component in what we're going to talk about later. And so who is the neighbor here? You have the lung there. Who is the neighbor? And when you are at the point of exhalation, you're holding and holding and holding, the heart all of a sudden is like, ooh, wow, I got more room. I can expand. I haven't had this room in such a long time. Bring in the blood, bring in the blood. And that's what happens. You're going to increase your cardiac output just by doing that. And actually, as you're doing this, you're going to start feeling the warmth throughout your body. Why? Because you have more blood coming in to the heart to deliver more blood throughout the body. It's a fascinating phenomenon. And it feels good because you have more oxygen delivered throughout the body. And so it's very important that, yes, we do the breathing. We'll get into more detail, webinar in March. We'll get into more detail. And that's a delivery system. You have to make sure you give a body what it needs, deliver it to the site of repair, location of damage. And what I find is that delivery system, especially if there's a stagnation, what's the fastest way and easiest way to open it up? It's the acupuncture. Acupuncture. You can open it up instantly, and that's why I want you to challenge your skill. Using distal point, even without the needles, to open it up. Can you stop a headache without the puncturing of the needle? Can you just use your finger? And that's challenge your own energy. And if your energy, if your love is strong, your magnetic field is strong. The more love you have, the stronger your magnet. And that's the interesting part. You can be off, but because the magnetic power is so strong, the energy will come to you. That's another thing that I'm finding. And so make sure how much love you have for the person in front of you. Make sure you have plenty of love. Love that heart, treat the heart. Endothelium, let's talk about that. That's another issue that we have in the modern medicine. We see a lot of hypertension. And in that hypertension, this has to do with delivery system. In that hypertension, what do? We give a medication, and all the medication that controls hypertension is to push the fluid out to give an illusion of the lower pressure. My question is, do you have too much fluid in your body? Not really. Somebody, oh, you have a sign of edema. Well, that's only one area. I'm talking about systemically. Do you have not enough fluid? And usually that's not the case. That's not the case. It's not that you have too much fluid. So think of PVC pipe. You have PVC pipe and garden hose. Which one's going to do this better? The garden hose. And so when we're born, our blood vessel is more like garden hose. But over time, because lack of activity and also the temperature, why temperature? Because vasodilation and constriction due to cold or hot. It help us do this. And now we live in an environment where it's tightly controlled in terms of temperature. And so we don't really use that. To the point, decided, I don't need to expand or contract. And yes, we know the component of scarring from the arteriosclerosis, right? The damage on the blood vessels. And we can get into that if you're interested. But that blood vessel, once it's damaged, it's not able to do this. And same with all the flow in the body. What allows that flow in the body? It's all the muscles. It's all the muscles. Whether it's skeletal muscle or cardiac muscle that pumps the blood, or a smooth muscle in your digestive tract and all the tubes. You have that squeezing. If you can't squeeze, things won't get through. And yes, we need ATP to release the contraction. Right? And so it's important that you have the water, oxygen, and nutrition get and deliver. Without the oxygen and glucose, we cannot generate ATP. Krebs cycle, right? And what's a byproduct of that? If you are using up too much ATP and the body cannot generate fast enough, you'll take a short route. And what's the byproduct? It's a lactic acid. And lactic acid, what it does to the body is that lactic acid creates a very acidic environment. And in that acidic environment, plus lack of blood flow, it's very acidic to the point it starts hardening the tissues. What kind of tissue? It's a tissue that has less blood flow. So if you look at tendon, is there any blood vessels? No. Muscle, yes. So tendons start hardening. How about ligament? Yes. So area that has less blood flow. How about joint? Inside the joint, is there any blood vessels? No. And so all those areas that requires blood flow no longer has that blood flow. How about the fascia that's wrapping around the muscles? Is there much blood vessel? Not much either. And so all those areas they require, yes, the blood flow, oxygen and glucose to generate ATP to release the contraction. And when it cannot release that contraction, it stays in a contractive state. And over time, it started to harden to the point people become naughty. They have knots in there. I call them naughty, yes. And once you have that knot, yes, we can break it up. And so the endothelium, I was going to talk about, you can use hot and cold shower to help with the vasodilation, blood perfusion, and also vasoconstriction. So what I recommend is, if you want to improve your cardiovascular issue, especially the blood pressure and vasodilation and constriction, you can do this. Acupuncture, yes, we can. We do measure blood pressure for one reason. We can change the blood pressure pretty quick for a lot of people just using acupuncture. Because acupuncture can decrease the cortisol level to the point that the blood vessels start to constrict and dilate. So it'll take you out of that sympathetic state and put you more in the parasympathetic state. And we're going to talk about that in a bit. And the emotion, we'll get into it more in March. So that vasodilation and constriction, you want to understand the pathogenesis. And in order to understand the pathogenesis, you have to understand what is normal. So you got to have enough ATP. You got to have enough blood flow. Blood flow is everything. That flow is everything. So you can do hot shower and cold shower. So you can go in the shower, do whatever you want to do. And when you shower, you shampoo, whatever. And once you're done, and start turning the water to hot a little more, to the point that the skin turns a little pink, not too hot, you don't want to burn yourself. And when it's a little pink, take it to cold. Take it to cold. And now in wintertime, that cold is really cold. Let's start counting. Mississippi 1. Well, we do New Mexico here. Same syllables. New Mexico 1, New Mexico 2, New Mexico 3. Count to 200. You want to have at least 4 minutes to create that physiological effect. And how do you know you have that physiological effect? You start shiver. So at that point, there's vasoconstriction. So your blood vessel is squeezing, squeezing, squeezing. So initially, you're allowing the blood to come in to dilate, 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 and also perfuse, perfuse, perfuse to escape the heat because it's too hot. Now, if you exercise, you may not have to do the hot. You can just go directly to cold because you're already vasodilated at that point. And so that squeezing function of the blood vessel, you're taking all the blood that's coming in and you're squeezing it further out. So what's it going to do to the further part of the capillaries? You're going to start developing better flow, the distal flow, because you're squeezing it further. And some people do it 3 times, and you can. I always end it with a little bit of heat. You don't want to be too cold. But if you're okay with the cold, that's fine too. Some people, that may not be good. So I do recommend if you have too much shiver, if you don't have the shiver, then that's fine. You can just stop the shower and call it good. I don't go to hot. I just go to cold. And now I just go outside. It's so cold. And the tub, you can soak in the tub. Some people do that too. You can also do that. And the delivery system, the mental emotional aspect, yes, emotion can cause the blood vessel to constrict. How does that affect the digestive system? It diverts the blood out of parasympathetic, meaning your digestive tract, into fight or flight, your muscle. And so when at that point you have pupil dilation, muscle constriction, you have all those things happening when you're in that sympathetic state. So the blood is actually diverted outward. Imagine if you're constantly in that stressful state. Your body is constantly in the sympathetic state. And yes, acupuncture can bring that. And that has to do with the cortisol level. And then third, the generation and regeneration, or the repair. It occurs when you're sleeping, not just sleeping in a deep sleep. If you're not in a deep sleep, well, it's not healing. And we'll get into more about sleep in the next webinar. And so we sleep in cycles. So per night, you want to have at least 4 to 6 cycles. And each cycle, beginning to end, is anywhere between 1.5 to 2.5 hours. And we have different stages based on the electroencephalogram, EEG. So you have beta, alpha, theta, and delta. And there's another wave that we know is gamma. And we'll talk about it another time. Gamma is the superconscious. So at the beta and alpha, you're more in the conscious state. And then alpha and beta, you start going into more of a subconscious state, meaning your conscious start to pass out. And then delta, you're in an unconscious state. There's no brainwave. And so this is a deep sleep. Healing occurs in the theta and delta. Theta is very interesting. And we can get into that more next time, the next webinar on that sleep and how can you stay in the state of flow. How can you go from this and be in the gamma state? And how can you wake up in the gamma state? And the timing, and we'll get into all of that. If you're interested, yes, join us next time. We'll be talking about it. So sleep is very, very important. Make sure that you're sleeping. One thing I want to talk about a little bit because this is important to digestion. When someone is stressed, that sympathetic is affected. But I'm going to give you a tool, not only you can use, you can recommend your patient to use as well. So we want to talk about cortisol. Cortisol has a bad rap. Why? We call it stress hormone. I don't call it stress hormone. I call it waking hormone. Cortisol helps us regulate the waking cycle. And it suppresses, yes, melatonin. So what stimulates cortisol, and we'll get into more detail. I want to give you a short, brief overview of it. We'll get into detail next time. So that cortisol level, when it's too high, so there's maximum and there's minimum. And in between, that's when we're in the parasympathetic state. That's a long word. And up here is a sympathetic. And sympathetic, as we know, we call it the fight or flight. Okay, or I call it the 4 Fs: fight, flight, freeze, or you are fudged. Yeah, it's fun in life, right? So in a sympathetic state, you become reactive. In parasympathetic state, you're responsive. So you exercise your ability to respond, meaning the signal, the knee jerk is a good example. The signal sensory going from here to here and back out because it doesn't get processed in the brain. Whereas responsive, it gets processed in the brain. It's not reactive. So what's interesting for soldiers, before they go to war, they intentionally increase their cortisol level by not feeding them on time, by waking them up in the middle of the night to increase the cortisol. Is it necessary? Absolutely necessary. Because at war, you want to be reactive. You don't have to think, you don't want to think, is that bullet coming towards me or not? Is it going to hit me or not? Too late. You have to be reactive. But we don't reprogram them when they come back. And that's why the PTSD. And when cortisol is extreme, it's actually not the cortisol, it's the adrenaline that's affecting all of that. It's adrenaline. And so we don't reprogram them. So let's look at some of the things that we can do in terms of our activities to control the cortisol level. So some of the ones that I think we'll be talking about that later. Let's take the questions now. Do I have any questions?
Yes. How do you make sure that you are being a conduit for chi to travel through instead of using your own chi when bringing balance to a patient?
Okay. Love amplifies. That's the fascinating part. When you're the conduit of love, at the end of the day, I got more energy than the beginning of the day. Why? I'm harvesting energy. And we talked about what is that energy? It is love. It is love. And when you give love, when the love goes from one heart to another heart, what happened to that energy? It gets amplified. It gets amplified. So the question is, and that's a good question, you want to make sure that you have that love. Do you care for the person in front of you? Now I'll give you an example. Let's say you have a long day working. You get home and you're tired, 6 o'clock. And then I call you up and I'll use Seth. Seth, I have a ticket to your favorite band to the concert tonight with backstage pass. Would you like to go? What happened to your energy? Where is that energy coming from? Is your love for something. Is your love for something. So making sure that you have that love in place. Don't do it for money. Don't do it for your status. Don't do it for whatever else is of the ego. You want to do it for the good, for the other heart. You want to touch that heart. Before I pick up the phone and talk to someone, what do? I ask myself, how do I want that person to feel when he or she hangs up that phone? and see if I capture that feeling, even if someone I don't know. And once I have that feeling in my heart, I pick up the phone and start dial the number. I don't focus on what I'm going to say, but what I focus on is the heart in front. In this case, yes, it is in front of me, somewhere else. So you always focus on the heart. Focus on the heart. The love is amazing. And so we'll come back to this. We'll have a little hanger here, but we will come back to this. Hopefully that answers your question. And so you always focus on the heart. And when you put a name on your schedule, ask yourself, where's that heart? How are you going to love that heart? If you cannot love that heart, your treatment, mediocre at best. You want to make sure your energy is in the right place. You're the conduit of love. If you're a healer, you are a conduit of love. It's not a title. It's not a title. And that's why I personally gave up the alphabets. The alphabet soup, I guess, that people call it. It doesn't matter. It doesn't matter of the title, whatever. What matters is, do you care enough? People don't care how much you know until they know how much you care. So you have to care enough. Another question?
Nerves, tendons, bone, fascia, cerebral spinal fluid are not blood. What are they in TCM? Jing, Ying, or what?
Okay. So the foundation, let's go all the way to the basic. You have yin and yang. One is substantial, one is non-substantial. One you can see, the other you cannot see. So what you cannot see is in general is the qi. And what is qi? Qi is energy, but energy plus heat. Can qi generate heat? When it's moving, it can generate heat. It can, the energy exchange, right? So one question that I challenge a lot of conventional medical providers, I ask them, is there any chemical reaction without energy exchange? You gotta have that energetic exchange. And what we're focused on is on the energy. Can energy supersede the chemicals? It can. And we can get into that more in the future. So simply put, it's substantial and non-substantial. And then the blood. So you have the yin. What is yin? Yin is blood plus a fluid. And as you know, you're over 70% in water. And it's a state, right? So a different state. They're all a type of fluid. It can appear to be solid, but because it's changing, there's still a level of fluidity. So you have the blood, and you have all the fluid, including the solid, all the other components. So you have blood and all the other components that makes up your yin. Hopefully that answers your question. Okay, any other questions? No other questions. Okay, so we got 5 more minutes, see if we can finish this part. So cortisol, how do you control cortisol? Yes, acupuncture can bring it down. And what's interesting is when we're treating PTSD, when patient comes in with PTSD, especially with soldiers, they're over here, that reactive state. And reactive state, we react based on our habit. We react based on our habit. So if you grew up in a family where the habit of any disharmony is arguing, the act of arguing and screaming at each other sustain a high cortisol level. And so they're always here. They can come down. And that's very interesting because it's different than, let's say, someone whose family, they sit down and talk. That sitting down and talk, the habit, it brings the cortisol level down to the point that they can talk things out. So PTSD stays up here a lot of it is a habit, but can you ask them to change habit? Of course not. You can ask them, don't scream. Not gonna work. So what are you gonna do to bring this down? So let's look at some of the hormones that help us control it. Some people, when they have a stressful day, they like to run or exercise. Exercise, we already know, endorphin. Endorphin can bring it down, yes. So that's one of the components, endorphin. But it takes time to exercise. And if you can't really exercise all the time to maintain that endorphin, because endorphin gets reabsorbed quickly. It's not sustainable. And so there are 3 other hormones we're going to focus on. So you have oxytocin, and people call it love hormone, but that's only half of the equation. Oxytocin is a bonding hormone in breastfeeding, in birthing is oxytocin. And that oxytocin is the giving. So if I give you a hug, my oxytocin goes up. If you receive the hug, your serotonin goes up. Serotonin is on the receiving end, the sense of abundance, the sense that you're taken care of. That's a serotonin. And then you decide to hug me back, and at that point, your oxytocin goes up, and I receive the hug, then my serotonin goes up. And that becomes a loop, an oxytocin serotonin loop. And that's different than dopamine. That's the other hormone. Dopamine is focusing on the reward response. So let's say when you're little, and I'll pick on Christy. Christy, take out the trash. No, I don't want to. Christy, take out the trash, and you can have your ice cream. Christy, do your homework. You can have your ice cream. And when you get older and you're stressed, what do you do? Ice cream. That's a dopamine response. Most of drugs focus on this too, serotonin and dopamine for psychotropic medications. Oxytocin, we use it, but mostly for birthing. So serotonin and dopamine, you do not want to use the dopamine. So how can we maintain oxytocin and serotonin loop? This is very important, and we'll talk about this. If you remember, when you're first in love, you're very forgiving, nothing bothers you. Why is that? Oxytocin, serotonin. A little bit of cortisol, no big deal. Because it's very high, oxytocin, serotonin. So how can we generate that oxytocin and serotonin naturally? Because that's very important. And I'm gonna leave you a cliffhanger because we'll come back and I'll give you the specific on what we can do to create the oxytocin and serotonin. Okay, hopefully that answered a lot of questions. I know we haven't really gotten to the digestion, but all this is necessary for us to understand what digestion is. Digestion is one of the key fundamental components of our health. And later we'll get into the blue zones, people who are living over 100 years old. And why? Why are they living? And now medication, that's the key. Now medication over 100 years old and a high concentration in different parts of the world. And let's look at some of the commonalities and what are they doing that is actually helping them to live at that age at such high level of health. Okay, I think we're taking 15 minutes break. Okay, and then we'll come back and continue and we'll have fun today. Thank you very much.